There are a number of transportation projects awaiting funding in the 5th District. Can you tell me about those and their prospects for receiving funding this session?
Well, the primary project list, the most important projects for the 5th District include SR 169, making improvements on that important corridor, the interchange at I-90 and SR 18 right there in Snoqualmie, which is an incredibly important freight mobility corridor, and then improvements along I-90 through Issaquah all the way into Bellevue. We need to have additional lane capacity, and we need to make improvements at the Issaquah on and off ramps, the two ones, and perhaps another underpass underneath I-90 in Issaquah that we're looking at as well. So, the 5th District is, we are poised to be so impacted by traffic and congestion. A lot of constituents in the 5th District have to commute to work, so congestion really impacts folks in the 5th District much more so than if you, say, lived in downtown Seattle and could bike or take transit to work. So anything we can do to mitigate congestion, improve traffic flow, and improve freight mobility, that's my number1 priority this session with respect to transportation. The chances of a transportation package, I'm really hopeful. Last year, currently right now, the proposal is in the Senate, and we are working with our Senate colleagues to include those 5th District projects on that list. So when it comes back to the House for approval, those projects will hopefully already be added in a project list. If we need to, we can amend whatever transportation package legislation here to add those very vital, important projects to ensure that those priority projects are added to any ultimate revenue package and transportation package in this session.
Your bill addressing the involuntary commitment of mentally ill individuals received a public hearing last Tuesday and passed out of the committee. Where is it now, and what can you tell me about this legislation?
Yeah, this bill is called Joel's Law in honor of Joel Reuter, who was shot and killed by Seattle police during, unfortunately, he was undergoing a severe mental illness episode. He had bipolar disorder, and in July 2013, he was shot and killed because he was on his patio, or his deck rather, at his apartment in Capitol Hill, and thought zombies were coming to get him, and so he fired a handgun and tragically had to be killed by the Seattle police because of threats to public safety. Joel had spent the last 6 months really devolving in his mental illness. His parents, who were from out of state, came to Seattle and really pleaded with county mental health officials to get their son committed, and were repeatedly told that Joel, their son, did not meet the standard for involuntary commitment. So what Joel's Law does is it provides parents and close family members an alternative access to the courts. Currently under state law, parents like Joel's mom and dad, Doug and Nancy Reuter, could not go to court directly and petition to get their son involuntarily committed so he could receive the help that he desperately needed. Joel's Law, if enacted and signed by the governor, would provide that direct access to the courts for parents and close family members. And so currently the bill is in the Appropriations Committee. It passed out of the Senate or the House Judiciary Committee last week unanimously. It's in Appropriations now to undergo fiscal analysis. Last year, Joel's Law passed the House, I think it was 96-1, so broad bipartisan support. We need to get it over to the Senate, and the Senate needs to do the right thing and adopt Joel's Law so we can get it to the governor's desk. It will change lives. Washington State today is only one of 7 states that does not allow close family members direct access to the courts to help their loved ones, and that has to change.
You also serve on the Healthcare Committee. What's been discussed in that committee since session began?
A couple of the bills, priority bills that I'm working on in healthcare. One is the telemedicine bill, and I think this has got real promise. Under the Affordable Care Act, hospitals and healthcare providers have to transition to the electronic medical record, and so our healthcare system really is evolving, and it's becoming really high-tech in nature. The telemedicine bill would simply provide for the same reimbursement to healthcare providers for a telemedicine consult as it at the same rate and level as an in-office consultation. So it would save patients, certain, again, this is not going to apply to all healthcare. Some specialties, particularly like dermatology or ophthalmology or neurology, are particularly well suited to provide consults via telemedicine, remote, secure remote IT platforms. And so this would save time. I think it would reduce costs as well, because patients do not need to go back for multiple visits, incurring multiple co-pays. They can take care of that via remote secure link up. And we need this bill last year, I think, also passed the House. It needs to now go to the Senate. The Senate is I think the Senate will do the right thing as well and enact this bill. Again, it's good for patients, it's good for providers, and it will reduce costs. The other bill I'm working on is called the Crisis Standards of Care Bill, that will provide immunity to physicians and healthcare providers who provide service to patients in the context of a declared emergency by the governor. Currently, right now, we've got Good Samaritan laws and other laws that provide immunity for volunteers, but for healthcare providers who may come in from across the country and who are compensated, we don't provide that immunity as well, despite the fact that we saw from Hurricane Katrina and Hurricane Sandy that the local medical infrastructure cannot handle the need, and so out-of-state help is desperately needed during those times of emergency. Providers aren't going to come in, though, when they may not have adequate facilities, they might not have adequate diagnostic, they may not have adequate sanitary mechanisms in place, but there still is a need for medical care. The physicians need that immunity so they will be they will not be disincentivized to come into a disaster area in Washington State and provide that care, all the while concerned that they're going to get sued for whatever malpractice, in light of the fact that they don't have the proper or adequate facilities in which to practice medicine. This only lasts during the gubernatorial declared emergency. A lot of states have done this as well, and I think it's good for, again, for patient access and good for patient safety and emergency preparedness.